Good evening, welcome to Military Strategies. We are live right now, May 7, 2026. The antivirus crisis is growing. A plane declares an emergency in flight because the safety bubble, the protocol is broken. And there is a risk of infection on the plane. And also flights are flying all over Europe with people infected by the Hantavirus. And the government of Spain says that it is not going to quarantine the cruise ship passengers, that it will let them go home if they want, and if not, they are on their own. Family, your likes, your comments. This is Military Strategies. This is really scary. Let's get started. Good evening, family. What a mess we have right now with the Hantavirus, the cruise ship, and the airplanes. What seemed like it was going to be something normal. Here, nothing is ever normal on this planet. Nothing is normal in this world we're living in. Infectados, emergency, an in-flight emergency during the evacuation of one of the infected. Infected. They asked Morocco for permission to make an emergency sea landing because the isolation bubble around the patient has broken. And Morocco says no. Mauritania says no. And where did the plane land? In the Canary Islands. The plane has landed in the Canary Islands. You're going to be blown away by what we've got tonight. What's more, right now, while we're talking, another plane with Hantavirus, with patients with Hantavirus, is flying over Europe and is going to land. It has been diverted to land in Malaga. Does anyone know or have anything to say? Well, first of all, that's a total bombshell. Minister Margarita Robles, Minister of Defense of Spain, who says what you're about to hear. If yesterday we were worried about the Hantavirus thing, now I'm not worried anymore. Now I'm scared. I'm scared.
In principle, we are working in coordination with the Ministry of Health, which follows the orders of the World Health Organization. We have already coordinated with them. Therefore, a military plane will go to pick them up in the Canary Islands when they arrive in the Canary Islands. It is a specially equipped military medical plane with the necessary safety measures to prevent any kind of contagion, even though they are asymptomatic people. All the preventive measures, both by the crew and by the doctors who will be attending to them, they are being transported by a specialized unit, which is the UMAR, once they arrive here in Spain.
Attention! We are going to send a plane prepared to contain an infection. But please, listen to what is going to happen when they arrive in Madrid. We also have the Super Chats open, family. I want to see your comments and opinions because this seems suspicious. This smells really fishy.
And only if they choose to do so voluntarily, because the measures being taken are ones they are choosing to follow voluntarily. They will go to Gomez Ulla Hospital, the military defense hospital. Everything is already prepared.
Those who want to voluntarily and not forced will go to the hospital. Those who don't want to go for whatever reason will go have a coffee at Puerta del Sol. We are live. We are live on Estrategias Militares. Muchas. I don't understand things. Many things. Sorry for laughing, because this isn't going to be very funny. A virus with a mortality rate over 30%. Some say it's even up to 40%. Where people have been infected. Switzerland has already reported its first case. on Swiss territory of Hantavirus. A person who shared a flight with an infected woman who later died. He got infected on a flight.
At the military defense hospital, those who voluntarily want to and have,
Those who voluntarily want to,
they must sign an informed consent form.
they have to sign a consent form stating that they want to be admitted.
They will be in quarantine in individual rooms. This is a different case.
Individual rooms, and the one who goes to have coffee at Puerta del Sol. Be careful, because there's more. Careful. You're going to be amazed. This is going to blow your mind. Well, it's already been confirmed that it's the Andean strain that spreads from person to person. It's the most dangerous strain. 3,840% mortality rate from person to person. Transmission has already occurred on both a ship and a plane. And they're going to let whoever it is go free through Madrid.
The Ebola case, therefore, these are isolation and quarantine measures, but not as strict as for people who are hospitalized. Still, a lot of safety measures need to be taken, especially for people.
What do you mean, not as strict?
It's a case that's different from the Ebola case. Therefore, there are some isolation and quarantine measures, but not as strict for people who are admitted.
He's trying to say that they aren't equipped to admit those people safely?
Many safety measures are needed, especially for those in contact with them. The quarantine continues as long as doctors advise.
Measures need to be taken with the people who are going to be in contact with them. Family, we are here right now. 6,800 people. We need to share this live stream. People need to find out about this. No matter what, please, I'm asking for your help. WhatsApp groups, Telegram, social media, Twitter. We need to retweet. We need to spread this. Pay attention to what you're about to see. The team, they're going to handle it, and they're handling it right now. With the infected people in Cape Verde. What could go wrong? This is the safety equipment that the staff has that is dealing with the virus. With a mortality rate of 38 to 40%, at this moment, masks, one for allergies, FP2 or FP1. Personnel in the nearby area without any protection. A boat where everyone is packed together, sitting down. That doesn't meet the requirements. What are we seeing right now in this story? Community. We've seen it in movies. We see it in military drills. And what's happening here? There are no personnel in EBQ suits with full protection. For this operation, I'm honestly shocked right now. I really mean it. I'm shocked right now. How can they send staff? Look, I'm going to say it more clearly. What we're seeing, and now I'm really going to say it clearly, from professional experience, not just as a content creator, but from professional experience, the clothes they're wearing are to avoid contamination from fluids. With fluids. There are openings everywhere. Look at those shoes. That footwear. Gloves. What kind of gloves are those? Gloves that aren't even sealed off from the rest. My goodness, it's just unbelievable, really. It's enough to go out into the streets and tear the whole country down. Let's see. One without gloves, another with the gloves under the suit, another has part of his wrist exposed. And the guys from the NGO who make millions of dollars a month don't have staff to get on a plane and send them there. Damn, them. They send you a plane that has to stop to refuel on the way. That has to stop at the, let's see. They send a medical plane that must stop in Morocco, the Canary Islands, or Malaga due to insufficient fuel to reach the destination. This is a mess. This is a mess. And they make it look like everything is all prepared. But also when they get to Spain, what does it matter? Pasa. What does it matter? Once they reach Spain, they can go home. It happens. And they put the operation together like that. With a boat. They send some guys out to the ship. Government of Spain.
Is a virus that spreads mainly through the environment, through their droppings or urine, by inhaling their droppings and urine. This type of transmission is quite rare.
What is exceptional? What is exceptional? As the people who are dying in Argentina and in the Southern Hemisphere. What is exceptional?
Bueno, I mean, in the literature there are very few cases in the world with just a handful of cases of something. Well,
let's see, I've seen so many cases all at once.
Of this kind, with very few people involved. In principle, transmission between humans is not common, but it cannot be ruled out.
And always. But let's see. Let's see. They're already lying. They're already lying. They're already lying, and it's only been 24 seconds. Here we go. Pay attention to. We already have 8 people. 8 people. It says that human-to-human transmission is unlikely. That it's not likely. Very well. Let's see what the WHO says about this topic. It's incomprehensible. Well, people, while we're talking about Hantavirus, we're not talking about Begoña, Pedro, Coldo, or Avalos, or about 5 young ladies of questionable morals who were contacted by phone to go to a party. Anyway, while we're dealing with this, they're doing it. I'm not going to say the word. They're doing it very well because they're keeping them distracted. Good job, government. Just great. The authorities in Switzerland have confirmed a case of Hantavirus identified in a passenger of the cruise ship, Ondius. He responded to an email from the ship's operator informing passengers about the health event. He went to a hospital and has tested positive. The guy shows up at the hospital after wandering around Zurich in Switzerland. He says, hey, I just got an email. He gets it on the 6th. And now they're tracking the people who were on the plane, the people who were on the cruise, the people who were everywhere. Track, track, track. We're doing well. Incredible. But be careful because there's more. This is the flight that departs from Cabo Verde with the infected person, the infected people. Del vuelo, RHH 023, in the middle of the flight. A medical emergency occurs. The flight requests an emergency landing in Mauritania. They deny it. They request it from Morocco. They deny it. And they divert it to Gran Canaria. And the island council. So people understand, the president of the island or the political leader of the island says they don't have any protocol for dealing with the Hantavirus. That there is no protocol. There it is. On the plane, the safety bubble's ventilation system breaks down. And all the people who are on the plane could potentially have been infected. And the plane lands. They said yesterday they would do it. They plan to send the plane directly today. The plane ended up landing in the Canary Islands. What a coincidence! The plane turns around. This is incredible. Look at what the plane is doing. Look at what the plane is doing. It starts circling while they're deciding whether to land in Tenerife, Gran Canaria, or Fuerteventura. And the virus is circling around. Meanwhile, the virus is circling. Meanwhile, they're deciding over here, calling Pedro Sanchez, calling everyone, the Minister of Defense, and that annoying woman from health we just saw. The plane going around in circle. Morocco wants nothing to do with it. Emergency declared on board. There you can see it. In the end, Pedro Sanchez gives the order to land. Gran Canaria Airport. There it is. Those images aren't from Spain, but it's the same plane. This is a real crime. And a really serious one at that. Well, look how lost they are. The plane. It's going to leave to replace this one. It was going to be diverted to Malaga. And since panic has spread in Malaga, people have started to get very nervous in Andalusia. Plus, there are elections now. They've been told not to go to Malaga. Push through no matter what. They're heading to Gran Canaria to pick up the crew that now has to be in quarantine. And the patient infected with the virus. Para llevárselo to Oslo. I've never seen anything so sloppy. The minister said, the defense minister said that the planes were going to be ready. I mean, they're bringing into our airspace, into our islands, our people, planes that don't meet the technical requirements for this kind of operation. And it's obvious. It had to make an emergency landing. This program is extremely intense. A lot of intensity. Right now.
Este tipo I mean, in his urine. This type of contagion, I mean, in the literature.
All the infectious disease experts, they have asked the government, please, they shouldn't let people off the ship. That care could be provided on the ship, that if they got off the ship, a field hospital would be set up somewhere with a low population, with a low risk of contagion. And they take them to Gran Canaria, where there are planes going, to Europe, to Africa, to the United States. There's no better place to spread a pandemic than the Canary Islands.
Pandemic that we have, there are very few cases in the world, with very few cases of a crisis like this, with very few people involved. In principle, transmission between humans is not common, but it can't be ruled out. And it only happens in situations of very close contact with symptomatic people.
Dios. Of course, being there on the cruise, sharing children among themselves. God. It's just that this is terrible. Now you're going to see the captain of the ship.
Nada, what we know. And we also know that he has well, actually, we don't know anything. Un 50%.
50% de letalidad, perdonar, que he mentido. Dicho about 40%. No, it's 50%. Heads or tails, you have a 50% chance of dying.
But I insist, the transmission is initially through feces or urine. And human-to-human transmission, well, it's not common, but it can't be ruled out, and it's one of the things we need to make sure of.
You're making sure by flying to the Canary Islands. And they're going to confirm that with the minister who says it's voluntary.
Well, for now, we are working in coordination with the Ministry of Health.
In coordination.
It follows the orders of the World Health Organization. We have already coordinated with them. Therefore, a military plane will go pick them up in the Canary Islands when they arrive in the Canary Islands. It is a military plane specially outfitted for medical transport with the necessary safety measures to prevent any kind of contagion, even though there are people like this.
If you're going to send them a plane, and we've already seen that the planes they're sending over there are a complete failure. I don't know, they're not sending these planes to Spain, mind you, but they're operating in Spanish territory. It's even worse. You have no control over the operation.
They are asymptomatic, all the preventive measures.
Spain has a division for bacteriological warfare and threats of this kind, with airplanes, as she rightly says, with professionals, real professionals in this field. And they can't, among European countries, agree to send a special NVQ unit with doctors and people specialized in this. And they have to leave it in the hands of what we've seen. The photo, for those of you who are just joining and haven't seen it, we're going to show it. And please, don't misunderstand. We're leaving it in the hands of people who don't have the proper safety equipment ready. It's not safe for them. It's not safe for anyone. They're putting them in a regular ambulance, which doesn't have air filters, which doesn't have anything. This is a real disgrace, a complete mess. But a big one, a really big one. It's unbelievable. I'm still amazed. I'm still amazed by this. We send planes to drop food by parachute over Gaza, but we don't send a plane to Cape Verde with an NVQ team. I don't understand it.
Intervention, both by the crew and by the doctors who are going to treat him, is handled by a specialized unit called UMAR. Once they arrive here in Spain, and as long as they want to do so voluntarily, because in any measures taken are ones people choose to follow voluntarily,
they'll be subject to voluntary measures. So what does it matter if you send a plane with security, if they're going to go home if they want to? Why? Why do they lie to people in such a blatant way? You're sending it, let's see. They say they're going to send a plane. When the boat reaches the Canary Islands, A, we don't yet know when the Hondius will arrive in the Canary Islands, since it's already en route. No, well, you'll see where the Hondius is. You'll see what happened with the Hondius. They say that when the Hondius arrives in the Canary Islands, they're going to send a plane prepared with all the safety measures. And when they arrive in Madrid, they'll tell them, get off the plane and go home. Go home. So, when you get there to the Torrejón base or wherever they're going to take you, go home. And if you want, before going home, go shopping. Toma or have a coffee here. It's absolutely crazy. The plane that stopped in the Canary Islands had 2 cases. It wasn't because of refueling, but because one of the isolation bubbles broke. Entonces, so the mission is compromised. The mission is compromised. I don't know what channel this is.
According to what we've learned, the stop was technical, but not to refuel. Instead, one of the isolation bubbles for one of the patients broke, so it needed to be fixed. And that's why they made that technical stop.
They've sent another plane that's now heading to the Canary Islands. Isla, Cape Verde, since they've been pressuring them to have everyone get off in Cape Verde on the island. Like, they've been told to leave. Right now, the ship is going at 11 knots. Where is it? Position of the London ship. Heading north. The Ondius is going to travel along the entire coast. Heading north past Cape Verde, Mauritania, and Morocco until it reaches the Canary Islands. And what's going to happen there? What's going to happen? You're going to see it now. The Gran Canaria Island Council. It seems it's run by the Socialist Party. He pressured Pedro Sanchez so that the ship wouldn't arrive there and have it sent to Tenerife. In Tenerife, it's governed by the Popular Party. The ship seems to be heading to Tenerife. Well, then look at this.
We want to express our absolute and categorical rejection of the Spanish government's intention to move the ship to Tenerife after an outbreak of Hantavirus infection was detected on board. We want to stand united with the government of the Canary Islands and specifically with its president, Fernando Clavijo, who is fighting to prevent the ship from coming to Tenerife. Tenerife cannot once again become the territory chosen to handle international crises that other countries do not want to deal with. It is unacceptable to try to put at risk public health safety, social stability, and healthcare capacity of our island through decisions made without consensus, without sufficient information, and without the support of the Canary Islands institutions. From Madrid, unilaterally. So we do not accept that Tenerife is used as a permanent contingency site because of our geographical distance from the mainland or for reasons of political convenience. Solidarity cannot be imposed by sacrificing the security and stability of our territory. We demand the suspension of any operation related to the arrival of the vessel until there is complete transparency about the seriousness of the outbreak. Manifestar nuestro rechazo.
That's it. Thank you very much. What is the president of the Canary Islands say? Mr. Clavijo? Familia, let me check. Give me a moment, fam. We already have it prepared here. Clavijo.
We technically maintain that if the passengers are healthy, there is no contagion. So it doesn't make sense for them to have to go to the Canary Islands to be repatriated. They can perfectly well do it from the Cape Verde International Airport.
Of course. If they're healthy, if there's no danger and they can go home voluntarily, why are you going to drop them off in the Canary Islands? What for? Why must they get off in the Canary Islands? Let them get off in Cape Verde and go to their country by plane. Those who are Spanish, Let them go to Madrid, to Barcelona. It's fine. That's it. They're healthy.
Come on, therefore, if countries want to send planes to pick up their citizens and take them back to their home country, why do they have to spend 3 days traveling to the Canary Islands? No one has explained it to us. No one has told us why.
Why do people have to travel on a ship where there has been or there is a viral infection with people who may not be infected? Thank God, just to put them at risk of infection. Why is the government doing this?
And the World Health Organization, just as it can request the protection of Spain or the European Union, can also request the protection of Cape Verde.
Why not ask Cape Verde for protection? They are more than prepared logistically there, as we just saw. The level of preparation is at end of the world levels.
Because it's the World Health Organization for the whole world, not just Europe. Therefore, if what we're thinking about is what's best for those passengers so they can return home and end this nightmare, the reasonable thing is for them to do it right away. Right away. It's a different matter for the passengers who are infected. And that requires medical transport with highly demanding protocols. And that's apparently also being done using specially equipped medical aircraft. Then the decision about why that ship is currently anchored outside the port of Praia, which has an international airport, and Sal Island also has another international airport. We don't understand what the reason is.
Well, Mr. President of the Canary Islands, the ship is heading to your island. But be careful, there's more, eh? Be careful, there's more. Thank you.
The Minister of Health has 2 messages from me. At 11:57 p.m. yesterday, she asked me for help to transfer a patient who
supposedly had gotten worse.
is paciente. At 1:26 a.m., I tell her that the health service is asking for the patient's status.
The health service is requesting the patient's condition.
And the circumstances needed to activate an absolutely extraordinary resource.
To activate the emergency service?
The minister doesn't answer me.
The minister doesn't reply. She's already asleep.
At 6 in the morning, I send her another message.
At 6, he writes to her again. This is a national emergency situation, you know? At 11:59, I send you a message.
A message with a document from the Canarian Service
This is incredible, huh?
of Health. And she still doesn't answer. You see,
And she still doesn't answer.
Minister, given that lack of response.
She still doesn't answer.
As the minister hasn't responded, I'll address Sanchez's request.
She went to Sanchez. Let's see what Sanchez said.
Sanchez tells me he'll talk to me later today.
Sanchez, I was going to call him.
Yeah. But they have indeed agreed to grant the request for absence.
They agreed he will go to the Canary Islands. That's it.
And that Spain is going to make that request for assistance.
Well, then Canarians take to the streets. Canarians, take to the streets. Is that? That's it, Canarians take to the streets. Now, when they pick them up, those 2 who are going to be picked up. Now, the 2 who are infected, the plane is about to land. It will land shortly. Let's watch the landing live on Military Strategies. Let's see how that plane lands. Well, then, afterwards, let's see if they don't have to stop in Malaga.
He also expects the Canary Islands government to cooperate. And I tell President Sanchez through WhatsApp that this cooperation must be based on the principles of institutional loyalty, transparency, and of course, coordination with the Canary Islands administrations.
Very well, Clavijo. The president of the Canary Islands did very well. Also, I find it unprofessional to handle a national emergency issue through WhatsApp. Via WhatsApp. It's as if I were to say now, just imagine. I said, Ariel Kanievski, an operation against Iran is going to be launched. I'm counting on your help. And we chatted on WhatsApp. No matter how good friends we are, no matter how close we are, There is a proper procedure that must be followed, and every step needs to be documented in writing because problems can come up later. Then come the lockdowns, the masks, people having to stay 2 meters apart. And since there isn't a clear chain of communication, because when a minister sends you a WhatsApp at midnight and doesn't reply throughout the next day, it means they don't care at all. That's what happens. It's a mess. Mas a complete one too. A complete mess. The plane that's going to carry from the other plane. 2 infected people with Hantavirus at 11,000 meters right now in the Canary FER. We're live right now, folks. Please, your likes are super important. Please share this live stream. Terrible. But watch out, there's more. Thank you for watching. Be careful. There's more. Agency F. Heads up, we've got breaking news. Heads up, we've got breaking news, and it's serious. It's serious. You're gonna go crazy. Currently, there are 13,000 of us. Breaking news. Let's display the plane image now. 1 second, because I want to check this. If this is true, it's already 4. To go live in a cave or on a boat. Live on a boat out at sea and spend the rest of your life there. If this is true, it's already like what I'm reading right now in the headline. I think we have not just one problem, but many problems. With the Hantavirus, unbelievable. What I just read. Let's see. Let's go. I'm going to show you a copy so that here there won't be. So they don't say you're doing clickbait. It's a Spanish news agency, one of the largest in Spain. Familia, we're live right now. This is some major breaking news. Antivirus crisis in Spain. Very clear. May 7, 2026. 1.52 in Spain. The Spanish Ministry of Health does not authorize the plane transporting 2 people infected with the Hantavirus to the Netherlands, which is currently in Gran Canaria due to an electrical failure in a patient's medical support, to depart with a new team. Bubble. So what is the plane that's landing for? What is that plane for? The Ministry of Health of Spain has not given authorization for the plane transporting 2 people infected with the Hantavirus, which remains in Gran Canaria due to an electrical failure in 1 patient's medical equipment, to leave with a new bubble team. They say that the plane does not have enough range to reach the Netherlands, which will force it to make another stop. The 2 patients who are currently infected are on the runway or in an area of the Gran Canaria airport waiting for this plane to land. A plane that, when it is loaded, according to what the authorities of this company have said, Camino does not have the range to reach the Netherlands and will have to stop along the way. And now where is it going to stop? That detour that shows a diversion to Malaga, is it going to stop in Malaga? To me, this already seems like complete madness. Let's see what the mayor of one of the islands, from a municipality in the islands, the mayor of Granadilla de Abona, has to say. What does this gentleman say about planes carrying Hantavirus cases, ships carrying Hantavirus cases, arriving on his island? I don't understand anything.
As the mayor of Granadilla Abona, I want to express my deep rejection of the arrival of the Ondio ship at the port of Granadilla. The port of Granadilla is a logistical and industrial infrastructure that is currently unfinished and cannot properly handle a humanitarian task like this. And above all, because what it does goes against what is desired. There is no common sense. The most logical thing would be to avoid having the people who are currently on that ship be transferred over 1,500 kilometers and 3 days of travel. We are asking for immediate action to transfer them from the nearest airport to their home countries so they can quarantine and receive care from their own healthcare systems if necessary. And also especially that the ship be disinfected at sea and not brought to a port where there is a nearby local population. It's just common sense, and humanitarian work needs to be done right now, not waiting 3 days before taking action. Of course, the way the Spanish government is handling things leaves much to be desired. The Ministry of Health hasn't even contacted the City Council, nor has the government subdelegation done so in this case. We've also noticed they haven't done it with the Tenerife Island Council or Canary Islands government, with whom we're working to express opposition and request reconsideration of this action. The Tenerife South Airport or the Port of Granadilla don't depend on the City Council, but the people do, and they deserve to be informed. And right now, we're finding out through the media, just like what happened during the pandemic, and the same thing can happen again, because we all know what we had to go through. In this case, the local population must be protected, and urgent action needs to be taken with this ship, helping them medically and especially disinfecting them to prevent possible infections.
It's chaos. It's absolute chaos. There's no way to make sense of this. I just read the official government statement saying that the plane had to stop to refuel in Morocco, and that Morocco denied the plane permission to land. And therefore, as an emergency measure, they have to land. Land? Otherwise, the plane would have crashed. Otherwise, the plane would have crashed without fuel. Could there be a worse botched job in history? And what does the captain say? Parar The captain of the ship, stop. What's he saying? Family, we're live. The plane has started its descent, 8,000 meters. We're live.
Good morning, everyone.
Good morning, everyone. This is my sad duty. I want to inform you that one of our passengers
Sadly
passed away last night. And people say, ooh.
Esther, this is tragic.
He says this is tragic.
It was due to natural causes.
It was due to natural causes, we believe.
También lo que sí fallecido. And also, whatever, deceased.
And because of medical problems that he was suffering from or had, okay, that it's not infectious. What?
So the ship is safe when...
Seguro. So the ship is safe.
Es un asunto muy dice, but of course it's a very...
Certainly, it's very sad. I'm not sure if this video is real.
So the channel.
One moment. It's real. Salud. It's the captain of the ship saying it's not contagious, that it's not a health issue. Squad.
He posted a video from April 12th from inside the ship. In it, the captain, April 12th.
One of our passengers passed away suddenly last night. Although it's a tragedy, we believe it was due to natural causes. Also, according to what the doctor has told me, any health problems he had were not contagious.
The doctor is now in serious condition. 7,000 meters. Going down. A live view right now of the plane that's going to rescue 2 people infected with the Hantavirus. Take them out of one plane and put them in another. I don't know how they plan to do it. There is no protocol. And of course, the government has already started up the media machine to attack anyone who doesn't want the ship to arrive in the Canary Islands. Spanish television.
At first, you have no complaints about government decisions because you haven't been informed of anything, President.
I have complaints about the government's lack of loyalty, transparency, and communication with the Canary Islands government.
They haven't told you anything, which is why I requested a meeting. No, so the government hasn't said anything to you, right? They haven't told you they're moving the second one to the Canary Islands.
Oficialmente, they haven't officially given us that information.
They sent him a WhatsApp message. Not officially. Hey, Clavijo, we're sending you a ship with people infected by a virus. And we'll let you know. By WhatsApp at midnight.
She doesn't have any news? Not even unofficially.
Unofficially, I have the same news as you, obviously. It appears the World Health Organization has reached...
Look at how the host laughs while defending the government. That's exactly why. People end up watching YouTube channels and get tired of watching news on TV. It's clear.
An agreement with President Sanchez. But President Sanchez hasn't told me about it. I don't know the terms of the agreement or the circumstances that led to that agreement. The minister only sent me a WhatsApp request for cooperation for the transfer of a patient who apparently was having difficulties, to which I asked her about the patient's condition in order to be able to provide the resource.
Just think about it. And nothing. And she didn't answer you. The government has unilaterally decided that the ship will arrive in the Canary Islands. Unilaterally.
Currently, we are very worried. That is the situation for the Canary Islands government. And I would like to be a bit more specific. We had a first meeting this afternoon between the national government and the Canary Islands Autonomous Community, which was the one the ministers announced in that press conference earlier today at noon. That meeting with European Civil Protection initially included various departments from the state government as well as from the government of the Canary Islands. Muy preocupados de esa reunión, and the truth is that at the end of the meeting, I think the feeling was that we went in worried and came out even more worried from that meeting. Two very, very clear points. First, we requested that we be informed in writing what medical criteria had been used to decide that the ship should set sail from Cape Verde and Praia and come to the Canary Islands. We understood that the healthcare capacity...
This is terrible.
Ahora, bueno, the healthcare capacities in Cape Verde at best were not adequate for Bueno.
If they are not adequate, we sent them a plane, an A400 an Airbus, loaded with a gigantic hospital, with ventilation filter systems, isolated tents, nothing gets out, nothing gets in. Different security filters, decontamination showers for biological threats, for disinfecting equipment. We sent him everything, even the staff. We sent the ship to the Canary Islands.
To respond to a health crisis, but that has nothing to do with the capabilities needed to carry out the repatriation. We understand that these are two different matters. There is an international airport.
Cape Verde and the Canary Islands both have an international airport. The one in the Canary Islands has millions and millions of flights every year. The Spanish government avoids transferring the plane from Gran Canaria to Malaga with the infected patient to avoid an institutional and electoral conflict in Andalusia. There are elections now in Andalusia. Dicen que don't stop there. Don't stop there. All right, let's review your super chat comments. The plane is about to land. Let's keep it in the background. Comments on military strategies now. There's a lot more information. There will be more. Right now, we have nearly 15,000 people watching the landing of the plane. That's going to take 2 infected people from the Canary Islands. From the island of Gran Canaria, where they've had to make an emergency landing because there was a problem with the isolation system of one of the patients. And it's not safe to travel on that plane. Also, the plane doesn't have enough fuel to make the trip to its destination in a single journey. It's going to have to stop somewhere, possibly on the Iberian Peninsula, to refuel that plane. A Bombardier Challenger 605 officially. The plane is diverted to Malaga. Let's see how the story ends and what we're gonna find en los próximos minutos, aquí en Estrategias Militares. Let's read the community comments. It's total decadence. Thank you so much, Julian. Campos Spain is already sending us that problem. Pedrito will take care of it. Deborah, do you think this is planned? 100%. You can't do it that badly. You can't do it that badly. For a minister to send you a message at 11:59, it's not a coincidence, so later they can't say it was the next day. that she doesn't answer you. It's not a coincidence. That the Prime Minister doesn't call you through an official channel is not normal. Because it's exceptional. Spain will promote it. Michelle, thank you very much. Muchas. Guillermo, thank you very much. Thank you. They want to slowly eliminate us. It's just that the bug has a 50% mortality rate. It's no joke. Estrategias de corazón, I ask you not to get upset. We don't want you to get sick. We all love you. This makes me sick. I'm sorry, Raquel. Y fear, because there are a lot of good people in danger right now because of a reckless government. Spain is in the hands of criminals. God protect them. Leticia. Thank you very much, Leticia. And fear. No offense, but the Spanish government doesn't care about its people. Why do you think it still has support? And why don't people protest? Take care. Definitely. It's a complicated issue. An issue. Very complicated. The president didn't win the elections. He made an alliance with separatist parties and representatives of terrorist groups. That's why he's president. Pedro Escamoso, he doesn't want a ballot anymore. Now he's a virus. Sofia, thank you so much. Fernanda, don't let him even land or come in. The Canary Islands have a problem. The Canary Islands have a problem. Serious. The Hantavirus, the politicians, and the country. Landing right now, 2,000 meters above sea level. He'll enter from the south side of the runway. The plane that's going to rescue. Gracias. 2 people infected with Hantavirus. Thank you. A disease causing severe pulmonary edema, hemorrhagic fevers. The Andes strain is the most dangerous because it is transmitted to people. Terrible. All of this is terrible. It's terrible and unbelievable. In any normal, sensible country, you wouldn't let people do this. You couldn't allow it. But since this is a country where nothing matters and it all makes no difference. That's why things are going so badly. But there's more. I told you there's more. Pay attention to this document exclusively on estrategias militares. Of what you're about to see now. Get ready. Ministry of the Interior of Spain. Issues a circular Pay attention to this. Initial protocol for police officers regarding the Hantavirus. Occupational Risk Prevention Coordination Area, May 6, 2026. A document explaining the protocol and the measures to be taken. There is no vaccine or treatment. Unbelievable. They have already notified the police. Let the police get it. They will be next. Masks. Opinions. Drop your thoughts in the chat right now, family. Fire the Minister of Health now. They won't do it. Cover your mouth again. That's to receive millions of loans. I don't understand the loans thing. Let's see. What happened in 2020? It was so that a global unit could have been created with investment from all countries. And it wouldn't cost so much money. From a prepared military team, Alice, with members from various countries, as in international operations. The United Nations should do it. The WHO should do it. To have cargo planes, prepared ships. Gracias for this kind of event. Thank you. We've mentioned this several times in the program. We're not clickbaiting. Military strategies is one of the few channels. When a piece of news appears about a virus, an outbreak, or something that happens anywhere in the world, we're the first ones here to tell you about it. That's why don't they create an international unit operational for this kind of event? The planes need to have the resources. Gracias. The field hospitals need to have the capacity to move the victims of that virus safely. Thank you. The WHO, which is part of the United Nations, all it does is issue statements. That's all. Close and prolonged contact. Right. I'm not sure how close it'll be. They said the same about a simple paracetamol pill. Things would get better. Landing right now. There it is. Live image right now. 3D recreation of the plane arriving right now to the Canary Islands. Studios, we are live on Military Strategies. 500 meters high. Already heading towards Gran Canaria Airport to transport in a very dangerous operation 2 people infected with antivirus in one of the largest airports by traffic in Europe. And definitely in Spain, starting the summer season. There was no other place on this planet to take the Hantavirus. We're seeing it right there. 360 meters. The plane approaching Gran Canaria Airport. We are live, family. Hit like and leave your comments. Military strategies. Here it comes.
There it is. A lot of people are wondering right now what's going to happen in the Canary Islands. Right now, there's already a plane just like this one on the runway that can't be used because there's a security breach. And the virus could be on the plane in its ventilation system. Now they're going to remove them. The staff who may have been infected and those confirmed to be infected, to put them on this plane. 90 meters, 70 meters, 60, 30 meters, 15, 38, 50. 8 meters, plane on the ground. Let's see where the plane is heading, because this is also going to be very interesting. The plane that's going to give has just landed assistance to those infected by the Hantavirus. "35 kilometers. Let's check if they've isolated the plane. This plane will go right here, next to the other one, to carry out the operation. We don't know if they've cut it off. The transponder, yes or no, that would be something that's possible. For now, it's still on the runway. Let's see if it reaches the end. And it does some kind of turn. It should have already come out. If it had gone to one of the terminals at this point. Let's see how far it goes. I think they've already turned off the transponder. They've probably already decided to turn it off so that no one knows which part of the airport it's in. That plane, right now. Let's see. What has the government planned? Or what deployment exists? We also lack images. But security deployment, there must be some, or there should be, around that plane. There should be an isolation zone. En este caso, la Guardia Civil. There should have been multiple security rings with even the army, in this case, the civil guard, deployed. A unit. Or several bacteriological warfare units. Because the plane has landed with an onboard emergency, an emergency involving a virus that has spread inside. Because the safety bubble is broken. Let's see, where is the plane going? No, the transponder is still on. The plane's location is current. Moving. Let's see if they're heading to an isolated area they've set aside for this operation, which I assume that it has to be this way. So there has to be a protocol. There has to be something. My God. I hope there is a protocol. There has to be. We don't know how long that virus lasts on surfaces or what temperature it can survive in. We don't know many details about the strain because there's a lot we don't know. The plane that has been taking people since April 25th has traveled halfway around the world. It has been all over half of Africa. The Airlink Embraer 190 has been flying around out there. We don't know what kind of disinfection it has received. What has been the story behind this? The passenger infected with Hantavirus could have arrived earlier than scheduled from Santa Elena. To transit through another airport. Where was that person? Where did he sit? Which lounges was he in? Was he in the VP lounge? Did he use any chairs? Did he use any restroom? Was he in Johannesburg? A security line with a lot of people standing in line? I think the plane has stopped here. Transponder. Or is it stopped there? Did they stop the plane there? Of course, just imagine that passenger leaving Santa Elena heading to Johannesburg. Passport control. We know how all this works. Those countries where it's very humid. People breathing, people crowded together, the line. Think about the situation that could be unfolding right now, at this very moment. Then the plane arrived in Holland. The next few days are going to be hectic. The next few days will be hectic. For now, the plane remains there. Or maybe they've cut it off. Or maybe the other plane is right next to it. Or they've disabled this route so that only this area here is isolated from the terminal. What a mess we've made. What a mess this has turned into. It's incredible. Tremendo, really, really incredible. I don't know, honestly. I don't know what you all are thinking right now. But it's terrible. It's terrible. There are 15,000 of us right now. I think it's a good time to recap. We have a ship heading to the Canary Islands with infected people on board. The source of the infection is headed to the Canary Islands. We have an air ambulance that had to make an emergency landing in Gran Canaria because the bubble that isolated one of the two patients who were on board has broken. All right, so there is a potential risk that inside that plane, in the ventilation duct or on surfaces, there may be contamination from the Hantavirus. Another plane has been sent to evacuate the two patients. And now we also don't know what's going to happen with the crew, whether they're going to be isolated or not, due to contamination risk in such a confined area during those flight hours. Take them to Oslo, or to the Netherlands, or to Holland, or I don't know where they're going to take him. The plane doesn't have the range to make the whole trip. Or that's what they had told us. The plane was scheduled to stop in Morocco. During the in-flight medical emergency, Morocco refuses landing permission. To be clear, if the plane approaches Morocco, they will shoot it down. It reaches Spain, and Gran Canaria responds. And here we are. An entire island, watching as its airport, its source of income. Morocco, the place that feeds them. It's in the news now, because a plane made an emergency landing with Hantavirus. Another will collect Hantavirus, and ships are delivering it to the Canary Islands. You just have to type Canary Islands into Google right now. And all the news is Hantavirus. Antivirus. It would be interesting to talk to Antivirus, the Hospitality Association representative, to see what's happening with cancellations. It would be very interesting. Nothing more, nothing less. There are British people trapped. There are Americans trapped. There are Spanish people trapped. And a government that is not capable of establishing a protocol to prevent the rest of the Canarians, the Spanish, and the rest of the world from getting infected. Family, thank you so much for joining us live. We hope this helps to bring light to the darkness surrounding the situation. We'll see you in a little while here on Military Strategies with more information, because I think a lot of people won't sleep tonight. Best regards.